Hi everyone, welcome back to my channel. My name is Dr. Uza. You can call me Sigira Mireille. And today we are talking about breaking bad news. Yes. So you might have just lost a patient recently, or you have witnessed the loss of a patient. And then you're wondering what is the best way to break the news to the relatives. Or maybe someone has a poor diagnosis and then you have to relay such an information, such a message, which is usually devastating to the patient. So the first thing to note is that there is no universal bad news. Whether news is good or bad depends on the person receiving the news. If someone has been suffering for a long time, hearing that that person has gone to rest might be good news for some people. But there are some situations where you have to assume, as a healthcare provider, that that is bad news. So in most settings, the ones who break the bad news, either if it's a poor prognosis or it is a patient has died, it's usually the doctor. It is the responsibility of the doctor to go and inform the relatives of this loved one that the patient has died. Now, these skills can be taken for granted until you're in a situation where you have found relatives who are about to attack you because of how you have broken the bad news. I was in a situation one time where I lost a relative, and the doctor really didn't put any effort. I think it was oncology, and then maybe it wasn't the first patient he's lost or something. The way he said, there's nothing we can do for your patient is going to die anytime soon. It wasn't respectful, it wasn't good. None of us felt good. None of us felt comforted with the way he broke the news. So I thought it would be beneficial to share this on my channel, and because it would be beneficial for you as a healthcare practitioner to know that you did the best that you could and you delivered such news with the utmost dignity that you could master. Yes. So let's dig into the points. The method I'm about to share came from an episode of Grey's Anatomy. I'll place it here. Which episode exactly I have forgotten, but it's a method of using 4 L's: location, language, body language, and leave. It's a simple mnemonic, easy to remember, that you can repeat over and over again. With practice, it becomes easier, though this news that you're sharing does not get any lighter. Location. Take your patient to a quiet room. Either your patient or the loved one of the patient who has died. Yes. Take them to a quiet room, somewhere where it's calm, somewhere where it's quiet, somewhere where you can sit and have time to talk to this person calmly. Explain to them what is going on, explain to them what is done, what can be done, and if the person has died, explain to them properly there. The thing is, for most of the people, should you have an unfortunate circumstance where the person died coming in through the ER is a busy place, or maybe you were resuscitating a patient and the relatives were already there to see it. So those are some of the challenging circumstances that you might find yourself in. But if it is possible, find a quiet place, find an empty room where you can sit and explain the diagnosis in a calm manner. The second L is language. So for many of us, in the languages that we use, we have different euphemisms that mean dead. Either the patient has left us, the patient has gone to a better place, or no longer with us, gone to heaven, such things. It is important that if the patient has died, you state clearly that the patient has died. Use proper languages, because don't use ambiguous words that seem kinda but are easy to get misinterpreted. if it's possible, someone might take gone to a better place to mean someone has gone to the ICU or someone has gone to a better hospital or something like that. And especially for children or elderly people or people in denial or in shock might not understand what you're trying to say if you're not very clear with what you mean. Yes. So the third one is body language. So for the body language, you have to make sure that your body says the same thing as your mouth. There's 70% of the message comes from the body language, only 30% comes from the words that you're actually saying. So your demeanor should have to represent respect. It has to represent the somber moment that is there, that is going on. When you're giving someone a poor prognosis or you're telling them that they have lost a loved one, your facial expression, your general posture, everything should show that you're in solidarity with the patient and you understand what is going on. Yes. And a simple pat on the back might be helpful for the person who's grieving. Don't go overboard and start crying with them. Give them this moment as their moment. Yes. Respect their grieving, respect their moment, and take take your time. Do not show with your body that you're in a rush. Do the best that you can for that patient at that particular time. Yes. The last one that we have is leave. After you have done your best, after you have given the patient the prognosis, you have done your best in the delivery, you've told them what is wrong with them, what you have done, and how maybe things just did not work out and the patient has died. You have stated that clearly. You leave the patient to grieve. You leave the patient's loved ones to grieve. Sometimes we might feel like the death, that like we are also involved in such a thing, but the biggest thing we have to remember when offering dignity in the last moments of a patient's life is also to know that their grief is important. No matter how much you are hurting as well, you have to respect the family and let them grieve in whatever way they do. If they cry out loud or they cry inside or they choose to cry somewhere else, you allow them to do that and you allow them to take the news the way they want to. So I dig into this and many other topics in an ebook that I'm writing, so watch out for it. If you have any experiences that you want to share, you can link them in the comments below. Like, share, and subscribe. Thank you.